Hello, I'm Dr. Della Brown White. I'm a program officer in the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Today I'd like to share some key information with you about preparing and submitting reports. As part of today's talk, we will be discussing annual progress reports, federal financial reports, inventions, audits, and final reports. Now for progress reports. The NIH utilizes two different types of progress reports. The first type is the streamlined non-competing award process, which is referred to as SNAP, and then there's also the non-SNAP progress report. Please see your notice of award in section 2 under terms and conditions to find out which type of progress report your award is granted under. For the SNAP or streamlined non-competing process, this is a modified annual progress report. IRB and IACUC approval dates for human subjects and animal subjects research are not required, but should be available upon request. Also for the SNAP progress report, you're not required to submit any information related to budget. However, as part of the SNAP progress report, you will provide information about any changes in other support for your key personnel, any changes in level of effort, particularly for key personnel or a principal investigator, and you will also report any significant anticipated unobligated balances. For the non-SNAP progress report, you are required to submit a detailed budget request for the next year of funding. You also have to submit your IRB and IACUC approvals each year in order for your award to be released. As part of the progress reporting submission, there are different processes for submitting a non-SNAP versus a SNAP progress report. For the SNAP progress report, these are submitted through the Research Performance Progress Reporting Module, or RPPR. The RPPR module is located in ER8 Commons. For the non-SNAP progress report, you still have to mail those progress reports into the NIH using the paper forms. There are different due dates based on whether or not you have a SNAP or non-SNAP award. For the SNAP progress reports, they are due on the 15th of the month preceding the month in which the budget period ends. A grantee institution may delegate authority to submit this progress report to the PI or the PD. For the non-SNAP progress report, these are due 2 months prior to the anniversary date of the award and must be signed and submitted by an institutional signing official. SNAP and non-SNAP progress reports have different requirements and components that must be included as part of the submission. For the SNAP progress report, again, which is submitted through the RPPR module, you must include a cover page, a list of accomplishments, products such as publications, websites, and inventions, participants. For participants as part of the SNAP progress report, this refers to key personnel. You also should include information regarding impact of physical, institutional, or information resources as part of any infrastructure work that is being conducted as part of this award. You will also identify any key changes that will be made as part of this award. These can be changes in scope, changes in personnel, or changes in the way that you plan to conduct your research going forward. Any special reporting requirements are also submitted via the RPPR module. This can include human subjects enrollment information, particularly if you are collecting data from human subjects. This will also include key information as part of the foreign components that you may need to identify, as well as any unobligated balances. For the non-SNAP progress report, again, which is submitted via mail using the PHS 2590 forms, you will include a face page, a detailed budget page, a budget justification, a progress report summary, checklist, all personnel report, and other support. I will give you a quick word about public access. All investigators funded by the NIH must make all publications publicly available no later than 12 months after the official publication of the manuscript. In terms of assessing progress, there are two levels of review. One level is done by the program officer. The program officer reviews the report to make sure of any and all progress being sufficiently made and to justify your continued receipt of funding. The grants management specialist will perform an administrative and sometimes a fiscal evaluation of the project. Submitted progress reports may oftentimes require revisions and clarifications by program and grants management specialists. For the SNAP Awards, there is currently a system called Progress Report Additional Materials, or PRAM, that is located in ERA Commons. This allows for electronic communication between grantee institutions and program and grants management staff at the NIH. Currently, use of the PRAM system is voluntary, but NIH expects to mandate PRAM for resolving all progress report issues. In order to ensure timely progress reporting, it is key for signing officials to find a list of their institution's progress report due dates. This can be found in ERA Commons. Late progress reports may result in late and/or possibly reduced awards. Now I'd like to move forward and give you some key information about federal financial reporting. The Federal Financial Report, or FFR, is a statement of expenditures reported against funds awarded to a grantee institution. FFRs provide an effective mechanism to account for grant funds. FFRs can only be submitted electronically through ERA Commons, and they must be submitted in US dollars and in English. Grantees are expected to submit FFRs timely and submit accurate reports. There are different due dates for federal financial reports, again, based on whether you have a SNAP or a non-SNAP award. For foreign SNAP awards, FFRs are only required at the end of a competitive segment. For foreign non-SNAP awards, annual FFRs are due within 90 days of the end of the quarter that their budget period falls within. Some information about inventions. All grantees must fully disclose to the NIH in writing within 2 months after the inventor provides written disclosure to his or her institutional official. Renewal applications and non-compete and renewal reports should always include a list of all inventions or a certification that no inventions were made. The NIH uses the iEdison reporting system to ensure that all grantees comply with invention reporting requirements. You also must submit an annual utilization report when you've been granted a patent to an invention or begin to receive royalties or licensing fees from inventions that are not patented. In terms of intellectual property, foreign grantees have the same rights and obligations regarding invention ownership as U.S. grantees. For audits, an audit is a systematic review or appraisal made to determine whether internal accounting and other control systems provide reasonable assurance of the following: financial operations are properly conducted, financial reports are timely, fair, and accurate, the entity has complied with applicable laws, regulations, and other grant terms, resources are managed and used economically and efficiently, and that desired results and objectives are being achieved effectively. If your institution receives $500,000 or more in HHS award money, you must conduct an annual audit. Foreign institutions can pay for an audit using funds from the 8% F&A budget. Foreign grantees can satisfy audit requirements with either of the two types of audits: a financial related audit, referred to as the Yellow Book, or an audit that meets the requirements of OMB Circular A-133. Final reports or closeout reports. NIH has 3 required reports at the end of a grant award. The business official has 90 days after the end of the grant to submit the required reports. These reports must be submitted by an institutional signing official or authorized organizational representative. The final progress report, at a minimum, should include a summary of progress made toward the achievement of the originally stated aims, must list any significant results, positive or negative, and list all publications that have been generated as part of the award. Enrollment data, including children, women, and minorities. Any deliverables that can be shared, such as cell lines or software, must also be reported. The final progress report should be submitted via ERA Commons or may be submitted via mail. You should always refer to your notice of award for all key mailing addresses for your progress reports. The final federal financial report is required for any grant that is terminated, any grant that is transferred to a new grantee, or any award, including awards under SNAP, which will not be extended through award of a new competitive segment. Final FFRs must indicate the exact balance of unobligated funds and may not reflect any unliquidated obligations. The final FFR must be submitted through ERA Commons. The final federal financial report covers different periods based on whether it is a SNAP award or a non-SNAP award. For a SNAP award, the final FFR should cover the entire competitive segment or as much of the competitive segment as has been funded through termination. For a non-SNAP award, the final federal financial report must cover the period of time since the previous FFR submission. You must submit a final invention report even if you have previously submitted reports of your inventions, and you must also submit an invention report even if there have been no inventions. Some tips for success in the NIH reporting. When in doubt, ask questions. Always contact your program officer or grants management specialist if you have questions. Your institution should create a plan for timely submission and also make use of available instructions and policies, particularly the NIH Grants Policy Statement and your Notice of Award. Thank you so much for your attention, and I look forward to your success in the NIH reporting system.